in Lusaka province. Diarrhea causes 1 out of every 5 child deaths. But Zambia is stepping out as a pioneer to defeat diarrhea. At clinics, communities and schools, Zambia saves lives every day in 5 key ways. Oral rehydration solution is an essential treatment given to children suffering from diarrhea. It prevents severe dehydration.
We see a lot of diarrhea cases in the clinic, and it's a common problem in the community. When the mothers bring in their babies for diarrhea, nurses will give them ORS. ORS is the most common treatment that the nurses give.
At oral rehydration therapy corners in health clinics, nurses give ORS to sick children. Nurses teach mothers how to prepare ORS and administer zinc at home to start healing their children even before coming to the clinic. They also teach them to provide food-based fluids at home, to continue feeding an infant with diarrhea, and to watch for symptoms that mean they should return to the clinic. Education on how to prevent diarrhea from occurring in the first place is another key intervention.
Sunga pa nyumba clean, kufaka manzi, kufaka chlorine manzi ya kunywa. Mwana kanya, kusamba kumanja na soap.
In the community, volunteer health workers share clear, targeted messages on diarrhea prevention.
The diarrhea cases have come down because of sensitizing the people in our communities.
But education isn't the only way Zambia is preventing diarrhea. A new effort is vaccinating thousands of infants in Lusaka province against rotavirus, the leading cause of severe childhood diarrhea.
I'm Teresa Ngambi Jerry, and my baby is Vusi Jerry. He's a month old. Most babies usually suffer from diarrhea. It's really important to have the babies have the vaccine against diarrhea because it's one of the major problems that we face here in Zambia.
We have evidence here in Zambia that a quarter to a third of all severe gastroenteritis cases are due to rotavirus infection.
Yeah, the babies are getting the doses of a rota vaccine. They are very enthusiastic because at least now that this will prevent diarrheal diseases in children, and they are very happy that will help.
And so that, coupled with introduction and promotion of use of zinc and ORS, should have a substantial impact. Our program is looking at potentially 15% in all cause under 5 mortality reduction in Lusaka province after 3 years.
Many diarrhea infections arise from drinking water that isn't safe. Just outside the city, in peri-urban communities like Chizanga compound, tens of thousands of people need clean water in order to stay healthy.
Water Trust is a community-based organization that is managing the water and sanitation infrastructure in some of these peri-urban areas on behalf of Lusaka Water and Sewerage.
Sustainability of these water sources depends on community involvement.
We have about 46 water points where the community is benefiting. This pump doesn't rest.
Lusaka province is the fastest growing region of Zambia. Safe water must be available and accessible. Policies to support all of these programs must be and are essential for effective implementation and long-term impact. The Ministry of Health in Zambia is using a 3-part strategy to rid the country of diarrheal disease, including promotive, preventive, and curative methods.
The promotive and curative are almost similar because we pass on the information to the public. As part of prevention, we are saying we are not only to approach in terms of encouraging the safe water, use of latrines, washing hands. We are saying there's also a vaccine.
Thousands of lives have already been saved through these 5 interventions. They are all part of creating a world where no child dies from diarrhea. Zambia is leading the charge.